Thank you very much, Charlotte. And I should have said at the beginning as well, as a project that's had a huge amount of patient involvement. We've also involved secondary care from the outset, and I think any piece of effective clinical transformation that I've ever been involved with, it depends on primary and secondary care working together, and I think this is one of the effects of the pandemic that's perhaps not well recognised, is that primary and secondary care relationships are probably at the lowest they've been for decades, which I think is a huge, not only a huge shame, but a huge problem. But hopefully in this project we'll take some steps to heal that, and also we'll have secondary care nurses actually in the group consultations to actually promote that communication. As we've hinted, a huge part of this, and one of the things we hope the project is going to achieve, is to leave a legacy of more specialised training in practice nurses within the east of England. And Lisa, who has been the driver from this project from the outset, is going to talk about the training and support package available, and then she'll hand back to Lee, who you heard from at the very beginning, because one of the innovative approaches we've actually used an innovative approach to evaluation, and that touches I think on something that Claire Browning raised in the chat about to develop a document that explores all the different models being used for cancer care reviews. And this project is going to be fully evaluated, and that hopefully will be one of the outputs of it. So first of all, Lisa, and then we'll lead on to Lee, and then we'll have questions at the end.
Thanks, Pete. Good afternoon, everybody. I'm just going to give you a couple of slides about the training support package. Next slide, please, Martin. So I guess one of the biggest things that have come out of this programme, and some of the big learning, is that although, as Pete mentioned earlier, there has been a material shift to use of technology, virtual consultations, etc., there is no current off-the-shelf bespoke training programme for delivery of virtual consultations. Hence, we have gone down the route of developing a training package. It's at the first stages at the moment, but that's also going to be including co-design. So as we learn, as we move through the programme and the phase rollout, we will adapt the programme, and we will be asking for feedback from patients and staff alike. As Pete mentioned, there is a pilot phase to this programme. However, it is a regional wide programme, and it will be rolled out over multiple cohorts across the region. It's a comprehensive package and support. It's not just about having an e-learning hour and a half and then go away and do it. It includes coaching, it includes telephone support, and ongoing support until staff feel they're competent to deliver the virtual consultation in an effective and confident way. There's also an opportunity for observation and support for the initial group sessions. And the good thing about the company that won the tender for this package is they are predominantly, all bar one, they have a clinical background from primary care, secondary care, palliative care, etc. So they will be in a position to help with some feedback if there's something that's raised by a patient at the session, not sure how to respond to it. You'll be able to contact those coaches to get some advice and support. There'll also be a module looking at train the trainer, and this is where for people that want to pass the skills on, build resilience in the team, new staff starting in the practice, etc., we'll be able to provide some of that training and support for new staff. There'll also be some case studies and evaluation, which Peter's already outlined. Next slide, please, Martin. So the good news is we have the training dates for the first module. There are 4 dates there. Primary staff will only have to go to one of those unless they would like some further follow-on support. It is virtual. It's a 3-hour session to start with, and there will be further modules moving down the line, and it will be focusing on different roles. So we're very aware that a clinician role will be completely different to a facilitator. And when we talk about facilitators, we're talking about people using the software, setting up breakout rooms, etc. And there'll be opportunities to practice skills, etc. And do some dry runs and testing sessions. So again, we really wanted to get to staff to feel confident and that they have the expertise in delivery of a virtual group consultation using the training and support from this package. And there's just on the right hand side, it's just a bit of an agenda for that initial training session, advantages, perceived barriers, objectives, roles and requirements of the team, etc. And about planning it as well, which is key for an effective outcome. Next slide, please, Martin. So just a quick where we are with this project and other work that we've done. We have developed a toolkit to support primary care networks and practices to roll out the project, which includes patient information leaflets, letters, etc., suggested agenda, timelines, etc., for the consultation, which can be adapted for local use. And I'll be available, the team will be available to help PCNs and practices develop that as we move through the project. As I said, we've already got the first module training available. That's not just closed to the pilot sites, it's open to primary care across the region. There are more videos and information becoming available, previous webinars, etc., and they're on the East Midlands Cancer Alliance website. And our plan is to have news bites, updates as we move along. So that's just a quick summary of the project so far. So I'm delighted now to reintroduce Lee.
Thanks very much, Lisa. And as has been mentioned plenty of times now, this is a project that's really put its money where its mouth is when it comes to getting patient involvement, and no less so than actually allowing patients to become involved in designing and leading the evaluation. Next